Hello everyone, this video is going to be a walkthrough of the respiratory section in the CPT 2022 manual. This is a little bit shorter of a section, so I'm actually going to do a walkthrough of a few practice questions in this video as well. So we'll get that all done in one video today, hopefully. All right, as always, we're going to have our tabs and our pins with us, and we're going to be looking at our 2022 manual. So I have put a tab here on page 217. That's the beginning of the respiratory system in this manual. And that's right after the musculoskeletal system. So here we start with our table of contents. We also have some really great diagrams in this beginning section that could be really helpful. This is talking about the sinuses. This is super important because whenever we are working in procedures related to the sinuses, they are going to be specified by the type of by which sinus we're working in. So this is really helpful to keep that in mind. So like I said, it's a little bit shorter section. So our table of contents is shorter. There's another really great diagram here, really simple. It shows us exactly the parts of the body we are talking about when we are working in the respiratory system. So even though we are looking at a smaller section here, we're still going to be following that same familiar pattern of going top to bottom in the body. So we start with the nose and the nasal cavity, and we work our way down into the lungs. So even though we're looking at a much smaller part of the body than, say, the musculoskeletal system, we're still going to follow that pattern. Additionally, what you'll notice in this section here in the table of contents is each subsection is going to have some very familiar sections that we'll see here: incision, excision, introduction, removal, repair. Those are hopefully by now very familiar, and they are repeated in each section here. So that helps us get a little bit more comfortable navigating it because we kind of understand the types of procedures you'll see in each of these kinds of subsections, okay? So we'll do a quick little walkthrough. And you'll see here we start with the nose, as I said, and then we will do incision, excision, introduction, removal of a foreign body. So that would be if there's something in the nose that needs to be removed. And then a repair, and that would include like a rhinoplasty. And then we have destruction on this page. Again, really good diagrams, illustrations in this section, really helpful. Destruction, when we are talking about the respiratory system, is usually going to be things like lesions or polyps. And then we have our catch-all section. And remember, catch-all section is still going to be specific to the nose. Then we get into the accessory sinuses section. And remember, in the table of contents, I showed you where we had that really great diagram where you can really visualize which sinus they're working in. And then we get into endoscopy procedures, again, of the sinus. What you'll notice in this section is there are a lot of parenthetical guidances. Just a lot in here. So I would go through and check each guidance. What does that mean? That means that when we have these parentheses here, these are going to tell us how we should or should not apply these codes. So these are going to tell us do not apply with these other codes. So yes, we can stack a lot of different codes together. We can report them in conjunction with each other, but these are going to give you the exceptions. So most likely this section is going to lend itself to using multiple codes. A lot of these procedures may use multiple codes, but this parenthetical guidance is really going to help you make sure you are not using codes together that should not be used together, okay? And there's just a lot of that in this section, so I want to hopefully draw your attention to it. So if you are ever going to be using 2 codes or more with one of these codes, make sure you check the parentheses, all right? Then we get into the larynx. And again, we're going to have that introduction, endoscopy, and then we have other procedures. Again, in this section, we do have a lot of parenthetical guidance as well. So I would make sure you at least draw your attention to that. And then our catch-all other procedures, again, specific to the larynx. Trachea and bronchi, again, following that same pattern. And this will show you what we're doing when we are doing a bronchoscopy, which is a very common procedure that you'll see. That gives us a really nice visualization of what we're working with. And then the thermoplasty is something that's kind of unique to this section. You obviously don't see that in the other sections, so you may want to just review it. With lungs and pleura, we do have quite a bit of guidance here at the beginning. I would recommend you read it and make sure you understand. This is going to be mostly about VATS, which is video-assisted thoracoscopic surgery. And it's just something that's unique. It's not terribly complicated. I mean, it's a complicated procedure, but coding, it's not terribly complicated. It's kind of unique to this section. So it's really important that you understand how to apply those codes. Then we get into incision, removal, introduction and removal. And removal in this section is going to actually include things like removing of the lung. So we'll also have like lobectomies, where we just remove part of the lung's lobe, but we will also have just like the entire removal of the lung. In fact, that's this code right here. And then, of course, when we're dealing with something as complicated as that, we're going to have lots of guidance here as well. So make sure you are reading all of the guidance when you're coding from this section. Then we get into introduction and removal, destruction, VATS, radiation therapy, and then lung transplantation, which is going to be a very complicated procedure, obviously. What's good about this section is there's not a ton of codes to apply. So that I think makes it a little bit easier. There's not too many variations on lung transplantation. There's some, mostly with if it has bypass involved, which is what these codes are. But it does have its own section here. So don't just remove a lung if we are doing a transplantation, okay? And then we get into, we do have our other procedures here on the back as well, okay? And a surgical collapse therapy, which is also unique to lungs. That's when we would intentionally collapse part of the lung for a specific therapeutic purpose. All right, so like I said, not a terribly long section, just a few of those things I wanted to bring your attention to. And now we can do a few walkthroughs of some questions and kind of get familiar with this section. So let's look at my PowerPoint. And we'll try a couple of them. We'll do a couple shorter ones, and then we will do a report, because I know that's everybody's favorite thing, right? Okay, so we're going to do an intranasal biopsy, and then establishment and subsequent insertion of voice button following construction of a transesophageal fistula. So intranasal biopsy seems fairly straightforward. A biopsy that is intranasal, nasal is going to be nose. So I feel fairly confident you'd be able to find this pretty quickly. The second one is written in a really complicated way, but what we're looking at here is two different things have happened, okay? We have created a transesophageal fistula, and we have also added in a voice button, which is a kind of prosthetic. Okay, so there's two separate things going on, but that doesn't necessarily mean we have two codes. I think this is a little bit complicated the way that they've written it though. So we're going to go ahead and look at both of these, and I'll show you how, if you read this statement and you had no idea what it meant, you could still find your answer with the CPT manual. Okay, so let's get started. I'll switch over to the camera again. Okay. So these are the two things we're looking at: intranasal biopsy, transesophageal fistula with a voice button. So for intranasal biopsy, I feel like we could find this very quickly. We know we're looking at nose, and we are doing an excision of some kind. We are removing something. So we would look here at the excision section. These are on 219. So we go to excision section, and look, our very first code is biopsy intranasal, which is the same thing as intranasal biopsy, okay? All right, if we had the removal of polyps or something else like that, we could come down here and look, we do have polyps and everything else that we might be removing from a nose, but we are just taking a biopsy. So just that very first code is going to be appropriate. So 30100. Okay. Now let's look at this one, transesophageal fistula with voice button. Now I'm imagining, if you are unfamiliar with the purpose of a transesophageal fistula, you might think, okay, maybe this has something to do with the digestive system because we're talking about the esophagus. Esophagus still plays a role in the respiratory system. So we know that we're likely dealing with the respiratory system because we're talking about something related to the voice, larynx area, right? But still, I feel like on a national exam, this could be really confusing, and you might not automatically end up in the respiratory system. So what I would recommend in this situation is, what is jumping out at you? Likely this term right here, voice button. So what I would do is I would go to the back of our book and look at our index and see if we can just look up voice button, right? And on page 1259, big old manual. All right, 1259, we have this code here. It's directing us to 31611, voice button. All right, that's a pretty unique phrase. So luckily that's listed here in our index. And so I would just start with that. Now, of course, now that you know what it is, anytime you see that, you're going to be able to go, oh, I need to go straight to the respiratory system. I know where this is. I know what section it's in. But if you didn't know, which I would imagine a lot of people wouldn't. Oh, my little tab got messed up. Okay. All right. Then you can always use your index. The index is not an perfect system, but it is still a helpful tool. So we are looking at 31611. So that is here, trachea and bronchi. I think earlier I said larynx. That was misspoke. It should be in trachea. We're here in incision, and we're looking at 31611. Okay. And here is our code here, and let's see what it says in the description. It says construction of transesophageal fistula and subsequent insertion of a speech prosthetic, like a voice button. A laryngeal. I missed that word. All right. So we have our voice button and our transesophageal fistula creation. So we made this fistula, we inserted a voice button. That's actually everything we're looking for in this question, okay? All right, let's go back and check. But I just kind of wanted to show you that we don't necessarily need to know exactly what's going on in the procedure in order to find a code on the national exam. Now, if you are working in the field, you're going to want to know the details of the kind of procedures that you're working on. So you will get much, much more familiar with it. But if you are new or you are just prepping for the national exam or something like that, some of that stuff might seem like a curveball, and it is, absolutely is. Okay, so we got both of those correct. Now let's do a report. Okay, so here's the really big report. Lots of things going on with this patient. Pretty confusing again, if you're unfamiliar or not, are still learning about reports. So I am pulling up the things that are important that we want to pull out here. Patient has pneumonia. That's what our post-procedure diagnosis is. Remember, whenever we're looking at these reports and we see the pre-procedure diagnosis differs from the post-procedure diagnosis, we're likely going to be going with the post-procedure diagnosis, all right? The other thing I noted on here, which your text likely won't note, is that the patient was on a ventilator. That can be very important, particularly if we need to report status as dependent on a ventilator. But for this report itself, the pneumonia is the diagnosis, which is a J code, I think, but I'm not going to do ICD-10 in this video right now. So this procedures that were performed here are a bronchoscope, and, or I'm sorry, they used a bronchoscope to do a bronchoscopy. And it looks like they brush wash biopsied. Okay, so when we are looking at these procedures, we are going to be doing a bronchoscopy biopsy because we do know that that is something that's being done. And then we're also doing the brushing, and then washing is included in that. But a brushing is a more invasive procedure than the washing. So we are going to at least have two codes here. A bronchoscopy with a biopsy and bronchoscopy with brushing, okay? And then we need to look at modifiers as well, because we've got multiple procedures happening here. So if you think back to when we talked about modifiers, try to figure out which modifier we use for multiple procedures, okay? All right, so these are the two things that we're going to be looking at. The other thing I wanted to note is that not all payers want you to include brushing when you also have a biopsy. So some of them would include brushing in a biopsy. It just depends on your payer. Most of the time for national exam purposes, we're going to separate them out. The other slight issue or unique thing I wanted to point out is when you're doing a bronchoscopy and you include a biopsy, we would only report the biopsy once, even if we take a biopsy from multiple sites. So they could say in there, took a biopsy from this site, this site, this site. During the bronchoscopy, we would only report that code once, okay? So that's something you may want to make a note of in your manual. All right, and speaking of manual, let's go to the manual and see if we can figure these out. Okay, so I'll go back to our respiratory section. We know we are looking at the bronchi because bronchoscopy would be an endoscopic procedure in the bronchi. So here we are. And I'm assuming if you went to the index bronchoscopy, it would also bring you back here. And then we have endoscopic procedures of the bronchi. So that would be bronchoscopies. Okay. So that's going to be on page 227. All right. Let's go ahead and check this out. Okay. So here's our endoscopic procedures. If you want to make sure you read our guidance here, always. We are going to go ahead and look through here. Tracheobronchoscopy, that is not what was described in our documentation. Here is bronchoscopy, rigid or flexible, includes guidance when performed. So whenever it says including guidance when performed, that doesn't mean you have to have the guidance. That just means if you used it, this code still covers it. And then this one is diagnostic. And we are going to be looking for one that includes, well, this first one here includes brushing or protected brushings. And that's just related to the kind of tool used. There's like an unprotected brush and a protected brush. So most likely it was just regular brushing unless it was documented, but this code covers both kinds. So this looks like it would fit our bronchoscopy with brushing procedure we're looking for, 31623. Okay, but we are still looking for one with a biopsy. And then when we look at our next page, this one has lavage, which we did not discuss, and 61625 is going to include bronchial or endobronchial biopsies, single or multiple sites. And that's when I was discussing that we would only use this code once, regardless of how many sites we were using. Okay, so 31625. Is going to be our code for the bronchoscopy with the biopsy. All right, so now we have both things that we're looking for, the bronchoscopy with the biopsy, bronchoscopy with the brushing, but we're not done yet, okay? And also, I just kind of wanted to note here, whenever we're listing it, we would do the biopsy first and then the brushing second, because this is going to be the more invasive, higher reimbursement procedure. And then, as I said, some payers would not want you to include brushings, but we would, for our purposes and for purposes of national exam, we would still use it. All right, but we do need to find a modifier. So let's just flip up to our handy dandy front page cheat sheet right here in the front. Remember, we are looking for multiple procedures because we did, these are not separate procedures, it's multiple procedures in the same surgical session. And that leads us to 51, which is one of our most common, probably 50 and 51 are going to be our most common modifiers. 50 is for bilateral procedures. So that's like if you had a lung procedure and you did it on both lungs, we would use that bilateral modifier because we did it on both rather than us specifying if it was left or right. Same with eyes, ears, anything like that. And then 51 is multiple procedures. So we append that to our secondary code. Okay. So this is how we report it: 31625, 31623, 51. Okay. So let's go back and check. Okay. 31625, 31623. So those are the two codes that we're going to use for that report. I think it's fairly straightforward. I think the difficult thing when we're looking at this is just there's a lot of language here, a lot of description, things like that, that can get overwhelming when you're in a testing environment. If you are sitting there working on it, and you're very familiar with the section, you really understand the procedures, yeah, this is going to be a lot easier. But if we're looking at a national exam setting and you have never worked as a coder, or it's been a long time since you have been in the healthcare field, or you've not taken anatomy and physiology recently, this is going to be challenging. It's going to be a little overwhelming. So it's important we are able to pull out the things we absolutely need to know. Okay. And so we need to know what the diagnosis is. We need to know what the procedure was. Okay. And so there are ways that we can pull that information out and not get bogged down by all the descriptions, all the measurements, things like that, that might not be very important for code selection in a national exam setting. Of course, again, you're working in this section. You are already a coder. All this information is going to be very, very important to you. And you are going to understand it a lot better. But when we're in that time crunch, just trying to get to that national exam, trying to understand what's being asked of us, this is how we pull out what's most valuable. Okay. So that is our respiratory system in the 2022 CPT. If you do have questions, feel free to ask, and we can go over additional examples or talk through some of the issues that we're running into. Thank you all. Have a great day.